What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to have a short recap on anatomy of the diaphragm. This is the diaphragm. The diaphragm is a fibromuscular structure, meaning it's got the fibrous part, which is this central white tissue stuff, which is called the central tendon, and also has got the muscular part, which forms the most of the periphery of the diaphragm. The diaphragm separates two important cavities. It separates the abdominal cavity from the thoracic cavity. Abdominal cavity from the thoracic cavity. But as you all remember, the diaphragm is the main inspiratory muscle, chief inspiratory muscle, meaning if you have troubles with your diaphragm, your respiration can be severely compromised. Respiration can be severely compromised and can be life-threatening. What are the four important things about muscles? Origin, insertion, innervation, and action. What's the origin of the diaphragm? The diaphragm is originating, it covers the lower thoracic aperture or inferior thoracic aperture, and posterior it comes from lumbar vertebra L1 to L3, and as it approaches on the lateral surface, posterolateral, it is originating from the lower two ribs, rib number 11 and rib number 12. But as it approaches on the anterolateral surface, it is been originating from the costal margin. This is the costal margin, as we can all see. The costal margin, and then anteriorly it is coming from the xiphoesternal junction, the junction between the xiphoid process and the body, the sternum, and then also on the other side it does the same. Insertion is going to insert itself on this the central tendon. The central tendon of the diaphragm is considered as the insertion of the diaphragm. What is the innervation of the diaphragm? The diaphragm is being innervated by phrenic nerves. You have two phrenic nerves, one on the left and one on the right. And phrenic nerves, they are coming from C3, 4, and 5. C3, 4, and 5 keeps your diaphragm alive. If you have damage at the origin, maybe of the spinal cord, for example, above C3, your diaphragm is totally compromised, totally paralyzed because of these nerves. Is the injury is happening above the origin of these nerves, C3, 4, and 5. But you can also have unilateral damage or unilateral paralysis of phrenic nerve, for example, on the right side, and the left side is not affected. And so for this case, you have unilateral hemiparalysis of the diaphragm, but you can also have bilateral damage. What about the action? We said when the diaphragm contracts, it pulls, it flattens, it becomes flat, and then it increases the thoracic, the vertical diameter of the thoracic cavity, and then it helps in inspiration. That's the main action. It contracts, it flattens. That's a very important thing to remember. Another important thing to remember about the diaphragm, it has got important apertures. Number one is this one, the cover opening. The cover opening is happening at the level of T8 vertebra. And the main structure that is passing through the cover opening is the inferior vena cava. We're going to discuss about it. But we also have another aperture here, which is for the passage of the esophagus, and this aperture is called the esophagohiatus. Esophagohiatus is happening at the level of T10, and other structures that are passing, we have the right and left vagal trunk, but we also have the right and left, the esophageal branches of the left gastric artery. We also have another aperture, another opening downside here, which is called this one. Let me show you. This is the opening from the abdominal aorta, and it's called aortic hiatus, and the aortic hiatus is happening at the level of T12. The thoracic aorta, once it punches the diaphragm, it becomes abdominal aorta, and it punches the diaphragm at the level of T12 at the aortic hiatus. What are the other structures that are passing through the aortic hiatus? We have the thoracic duct and azygous vein. Another important clinical correlates of the diaphragm, we've already mentioned about the paralysis of the diaphragm due to damage to of the phrenic nerves, injury to the phrenic nerves. But we can also have referred pain, which is not really happening in the diaphragm, but for the diaphragm part we have the irritation. If you have irritation of the diaphragm, you can have hiccups.
hiccups. If you want the details about this, you can refer to the main video that is discussing about the diaphragm. But also the stomach can burge and get into the esophageal hiatus, and this is called the hiatal hernia, hiatal hernia, and these are the main clinical correlates. All right, this is it about the diaphragm. See you soon.